was diagnosed with pancreatic cancer. Dr. Shamamian was the surgeon that I was referred to.
She was referred to our group, having undergone a CAT scan for some vague abdominal pain that demonstrated a mass in her pancreas.
Debra had a very serious, life-threatening malignancy, and the statistics are extremely poor for patients that are not able or capable of undergoing surgical resection of their disease.
The tumor is very close to different structures like veins and arteries, which makes it very difficult for the surgeon to remove it completely.
The really unique thing we have at Montefiore is the collaboration between physicians.
We went through different options, including doing treatments with chemotherapy, using a very aggressive chemotherapy regimen in combination with radiation to try to reduce or shrink the cancer, to try to get her to a successful operation.
They talked me through everything, explained everything to me regarding my chemotherapy and the radiation, what I would be going through, you know, how many hours it would take.
I feel it's really important to have that connection with them so that they trust you, and then you know that they understand the complexities of their care. So you have to be available to talk to them or just bring them through it.
Surgery was extremely successful. I think being aggressive, using the aggressive multimodality approach that we took with Debra really worked to her advantage.
It was very successful in terms of the outcomes because she's cancer-free and she's doing very well. But in other terms, it was very successful because the team worked very well together, and there were no delays in her treatment, and everything was very well coordinated.
I remember her being discharged from the hospital, and we were all just really happy that she had recovered and she was going home and she was feeling well.
I'm happy I chose Montefiore. I was just happy to have a Bronx hospital that I could choose instead of going down into Manhattan. And the care there, I can say, has been outstanding. When I got home, a few days after being home, Dr. Shamamian called me, and I was really surprised that he called me because I said, you know, I have an appointment with him like next week, and he's calling me just to check up on me to see how I was doing.
And I think you need to have that dialogue with the patient. It really doesn't take long. It takes really a couple of minutes on the phone. They feel better, I feel better, and we know that they're going to be able to get through their therapy.
There's no evidence that her tumor is coming back, and she's recovering, and she's getting ready to go back to her full-time job.